Hey, it's Scott. And in this week's Give Me Five, again, coming to you from Miami Disaster Medicine Conference, I'm again joined by Wendy from the Florida Poison Control Center. And what we wanted to quickly touch on in this week's Give Me Five is kind of neat, whereas it's from the Poison Center perspective, simply what they want you to know about what actually happens when you call 1-800-POISON-HELP-ME.
So we support providers in a lot of different ways, and I think sometimes people think of us as being primarily for families, but we support providers when they're treating a poison patient. We can advise about the type of poison intervention that you might need. So do you need antivenom? Do you need an antidote? Do you not need that antidote because it's actually dangerous or risky? What other complications might be looking for? It's also very valuable from a liability perspective, right? Because when a provider can document that they engaged the poison center early in the process, if there's ever a question about the outcome or what care they received, it's helpful to say, listen, we engaged poison control, we followed their recommendations. So we're there to help. When you do call the 1-800-222-1222 number, you're going to speak to a doctor, nurse, or pharmacist who does nothing but treat people who've been poisoned and support providers. So tremendous expertise at your fingertips, and your patients actually have the same resource available to them from home. So we are HIPAA exempt, so when we do our follow-up calls, please feel free to give us whatever information we need. We're not going to be sharing it inappropriately. And your patients, if they're calling us from home, they should know also that the services are confidential. We're not sharing that out with anyone who doesn't need it. So we want to make sure few people know to use us, whether you're in the hospital or whether you're at home, and we are happy to help, and the services are always 24 hours, free, fast, and confidential.
The only question that I had just in follow-up is when you call 1-800-POISON, it's on a recorded line?
It is. So our calls are recorded. That's very helpful for us from a quality perspective, of course. But also every once in a while we'll get a situation where, someone says we said something and we didn't,
Right.
or whatever. That's very helpful. And so, we're always trying to improve. But I have to say our quality, our satisfaction is extremely, extremely high from our callers. And, we care deeply about what we do. So I feel like pretty good about what we're offering.
I just brought that up because twofold. Number one, at an ER that I worked at for many years, it was actually our policy in the ER that if anybody came in with anything potentially, it was actually our protocol that we had to call poison.
Yep.
And it was in the chart. You had to document, you called poison, they said this.
That's awesome.
But it was just the way that worked. So it was just the standard was everybody, anything you called, and that was it.
Yeah. I mean, that's the ideal for us, right? We want to be part of your protocol. We want to be just part of you reach out and get the help you need. But I have to say that it's quite uneven. So not every hospital has that practice. It's a little better with our children's hospitals. They tend to utilize us a little more consistently. But we're really there for everybody, whether it's a drug overdose, a chemical exposure, an occupational exposure. It doesn't matter the age. So we'd love to help more people given the opportunity.
And just following up on that, when you call and it's recorded from the medical legal perspective, that really is important. Because if something happened and inevitably something seemingly goes wrong, to be able to have that recorded line saying, here is what we were told that we should do, that's huge, because this is people who are experts in this field who are saying, you know what, this is literally what we do every day.
Yeah, you don't have
this
to go
is what
alone.
we recommend that we do.
Right.
And if you choose to do it or not do it, I mean, that's up to you. But in the event that something goes icky and it goes to court, to be able to know that it's recorded and to have expert guidance in that regards to back up what you did really makes it a whole lot easier in the event that it actually goes into some sort of legal proceedings.
And we've talked to our people in our EDs, and they're saying, that really only 2 to 3% of their cases involve toxicology. So, they don't have as much, familiarity with it, or there's a new drug that's come out or a new product on the market like the Tide Pods or some of these things where their providers are seeing it for the first time and are surprised or whatever. So we're there to sort of help them with that new circumstance. So we're happy to do it. It's an important part of what we do, our service.
So as we finish, remember the infamous 80s song with Huey Lewis, I Want a New Drug. There's always going to be new stuff out there. And in the event that you come across something that you see every day, or more importantly, something you don't see every day, knowing you've got somebody that can help you out when you need it really makes a difference.